Well, welcome to week 6. We have an exciting opportunity this week to talk about the catalyst behind our DNP projects and to understand a little bit more about the relationship between that catalyst and the ultimate goal of health transformation that's sustainable, just, and innovative that we're working toward together. So here we are together in week 6, and let's consider for a moment what a catalyst is before we begin talking about its role in our DNP project. So Merriam-Webster says a catalyst is a substance that enables a chemical reaction to proceed at an unusually faster rate or under different conditions than otherwise would be possible. So this is something that's enabling an effect under different conditions or more rapidly than could happen on its own. So it's driving transformation, it's driving change, as you can see. So a catalyst really is about new possibilities, and that's what it's about for your DNP project. For you to begin to develop your skills for envisioning a better future state in your practice arena with your clinical practice partner. And out of that vision, use your skills for analysis, evidence-based practice, and your pre-existing expertise to envision new possibilities together. So let's review briefly the catalyst for change at the community health center example we talked about. Now we discussed how a catalyst in this situation really came from the bottom-up partners, the physicians and the nurse practitioners seeing gaps and experiencing problems with procedures being set up and vital sign accuracy that minimize their ability to see patients rapidly and deliver excellent care to everyone on their schedule. So that particular problem of clinical skill and procedure preparation didn't remain simply a problem, but rather it was converted into a catalyst for change because there was alignment between that particular clinical problem, the organization's new focus on clinical quality improvement by hiring a director, and a clinician who worked as a facilitator to link all of these resources together. So that was a catalytic process at the community health center. And in the women's only workshops that we talked about from Afghanistan, a key catalyst was an outside-in partner, an international NGO organization, and the obstetrician who started working on the women's birth histories. That outside-in technical partner then, using these principles of sustained transformation, catalyzed interaction and collaboration between the women in the villages, and we saw how that resulted in one woman with an 8th grade education identifying the need for health-oriented literacy in her own village, and that one woman's vision then catalyzed 468 other locally specific literacy programs in that region. And because there was such a focus on health behavior in the literacy programs, you also saw a drop in the under 5 mortality ratio by 40%. So that was a catalyst in the Women's Only Workshops instance. So how about for you? What is a key catalyst that's driving your DNP project? Because that catalyst that starts the process needs to be funneled toward the creation of human energy, input, collaboration, using the strategies and techniques of the model for sustained transformation in order to reach that better future state. So the catalyst is merely the beginning, but it has to be focused on the end goal of transformation. So how do we convert it? What are some of the mechanisms? Well, we've talked at length about the model for sustained transformation as depicted here. That's one of the key mechanisms in this process. And we're also joining it with evidence-based practice model so that you can use both of these simultaneously to envision a better future state and guide you along the way. So regardless of where this catalyst starts for your DNP project, you can begin to strategically think about how you're going to utilize the 4 principles for sustained transformation, how you're going to create a systematic process for change and improvement, and then how you're going to spread and disseminate that change to other similar contexts. So your project might have a catalyst that's starting from scale 1, something where there's a local experience, challenges or frustrations in clinical care delivery, like in the community health center example. That could be a place where your project starts. Or it could be that a healthcare organization that you're partnering with has a national mandate, for example, around Medicare readmissions for congestive heart failure patients, and perhaps your organization has a high proportion of CHF patients who had readmitted. And so that organizational goal of reducing readmissions in order to capture some revenue that they were penalized for in the previous fiscal year could be the impetus for your project. So that's starting at scale 3, it's starting at the system level, or scale 1 at the bottom, implementation level. Where it's starting isn't that important other than in the planning process, and understanding which level of scale you're starting at can help you to create a strategic vision for your project. But regardless of the level of scale where your project is starting, it's being designed with the hope and the intention and the purposeful design for forward momentum, so that the transformation that your DNP project catalyzes in the organization can spread throughout the clinical unit, can spread throughout the organization, and spread to similar contexts. So we're going for that forward momentum in the DNP project design. And so I'd like you to take a few minutes and pause the video and think about what is the catalyst, or what are the catalysts for your DNP project, and then come back and join us for part 2 of our discussion. So as we look at catalysts, there could be catalysts coming from bottom-up partners, as we talked about in the community health center example, outside-in partners, as we talked about in the Hazara example, or top-down partners, as we talked about in the CHF readmission example. All of those partners, levels of partnership, could contribute to the catalyst for your project. And your key goal in thinking about the catalyst, where it's coming from, what's driving your project, is really to bring strategic alignment among the partners, or among the catalysts that are driving your DNP project. For example, if your project is starting as a bottom-up initiative of frontline nursing staff frustration with hospital discharge teaching among CHF patients, that might be what's driving your DNP project. How do we improve the quality of nursing discharge teaching? But unless you strategically bring together your own expertise as an outside-in technical partner, perhaps, as a DNP student, unless you bring in the perspective of the top-down decision makers, perhaps the unit managers, or the admitting physicians on that unit, or the nurse managers, or other staff who have decision-making power, it's unlikely that your DNP project is going to have substantive impact in that unit, much less outside of it. So this week is really focused on causing you to reflect on the catalyst that's starting your DNP project going, or the multiple catalysts, so that you can bring them together in harmonious alignment. So think about your catalyst. What is it? What's driving your DNP project? How do you take that catalyst and then convert it into human energy, into engagement, into participation, in order to transform the context where you're working? So that's what our time together this week will focus on, and what your assignments will focus on. Identifying the catalyst so you can begin to convert it into positive change. As you have a clear picture of what that catalyst is, or what those catalysts are, you'll have a better understanding of the current state of your DNP project and that will enable you to more effectively move toward transformation, and especially begin to harmonize discrepancies or challenges, differences of perspective or opinion between the various contributors to your catalyst. So you'll be implementing principles of sustained transformation to design strategies to bring allegiance and harmony between those partners. And that's all of our content for this week. We'll do another slide deck on the specific assignment around your catalyst, identifying and analyzing it so that you can manage it strategically. But otherwise, have a great week. Feel free to listen ahead into our weeks ahead. Take care.